Welcome back. My name is Jen Robohm, licensed clinical psychologist and faculty for the Family Medicine Residency of Western Montana. I'm talking to you today about climate change and mental health. The learning objective for this section is to describe direct mental health impacts of climate change anticipated in Montana due to climate change-related disasters and extreme weather events. Most of the research on the mental health impacts of climate change has examined mental health outcomes directly related to climate change-related weather events and disasters, which are often dramatic and characterized by a discrete beginning and ending. Notably, extreme floods, hurricanes, heat waves, or wildfires can be highly traumatizing due to personal injury, injury to or death of loved ones or neighbors, lost housing or personal property, and disruptions to livelihoods, neighborhoods, and communities. For many of us, wildfires such as those near Searly Lake in 2017 and Lake McDonald in 2018, flooding such as that from the Clark Fork River in Missoula in 2018, and heat waves like we've experienced in Montana this summer have captured our attention and forced us to pay closer attention to climate change. In the coming decades in Montana, our climate modeling predicts that we'll experience larger and more frequent wildfires, longer fire seasons, more heat waves, more spring flooding, and a greater likelihood of extreme storm events. One way to think about mental health outcomes after a natural disaster or emergency is that there are 4 buckets or categories that everyone falls into. Many people will have some transient reactions to the crisis caused by loss of familiar routines, greater social disconnection, higher stress, and perhaps added financial concerns. Some people will experience common and potentially severe behavioral health challenges such as depression, anxiety, substance use disorders, or PTSD that will begin during the crisis or will get worse as a result of the crisis or efforts to contain or respond to it. Occasionally, individuals will do well initially but will develop symptoms after a delay. A frequently forgotten group is those with chronic or severe mental illness, such as bipolar disorder, schizophrenia, psychotic or delusional disorders. Many of these individuals will experience exacerbations as a result of disaster-related stressors, disruptions to necessary routines, and inadequate resources. Importantly, a majority of people will prove to be resilient despite significant adversity, able to cope, bounce back, and experience positive mental health in the aftermath of a disaster. There is increasing evidence that extreme climate change-related weather events or disasters, which are becoming more frequent, intense, and complex, can trigger a host of direct mental health responses. Although prevalence estimates vary from study to study, these mental health concerns include acute stress responses, post-traumatic stress disorder, anxiety, depression, complicated grief, survivor guilt, vicarious trauma, recovery fatigue, substance abuse, and suicidal ideation. Such events also impact the mental health of children. Researchers have estimated that between 5 and 43% of children impacted by an acute disaster will experience PTSD, and many will suffer from depression, anxiety, sleep disturbances, attachment and behavioral disorders, and other mental health challenges. This makes sense when we recognize that children are reliant on their parents, teachers, and others to support them and keep them safe, and that social infrastructure can be easily disrupted in an emergency situation. These data suggest strong needs for both immediate intervention and continued community support after the initial crisis has passed. How much support any one individual, family, or community will need depends on a host of factors, but female gender, socioeconomic disadvantage, high disaster exposure, low psychosocial resources, and pre-existing mental health conditions are consistent predictors of worst outcomes. Importantly, effective community response in the aftermath of a crisis can also facilitate recovery from disasters. 2 of the climate change-related weather events and disasters most likely to occur in Montana, heat waves and wildfires, have been linked to significant mental health impacts. Many of us have learned this summer that heat waves can make people cranky and irritable. But exacerbated mood or behavioral disorders, violence, aggression, sleep disturbance, suicide, and psychiatric hospital admissions have all been linked to heat waves. Notably, heat can also impair the ability to regulate body temperature in individuals taking psychotropic medications, so people with mental illness can be at even greater risk. Research on the mental health impacts of wildfires has revealed increases in PTSD and depression in adults, and depression and suicidal thinking in adolescents. Importantly, despite these needs, in the aftermath of at least one large wildfire, researchers found that mental health services were one of the most common unmet needs. There's also growing attention to the mental health of first responders, as high rates of depression, substance use disorders, anxiety, PTSD, and suicide have been noted in wildland firefighters. In summary, while the majority of individuals in Montana who are directly exposed to climate change-related weather events and disasters will likely prove resilient, some will experience significant mental health impacts such as PTSD and depression as a consequence of their exposure. Those affected will include both adults and children, along with some first responders. Prevalence rates will likely vary, and certain personal characteristics, such as female gender, pre-existing mental health challenges, extent of disaster exposure, and social support, will help to determine who is most impacted.